Frontotemporal neurocognitive disorder represents one of the most devastating and misunderstood forms of dementia affecting thousands of individuals worldwide, silently transforming vibrant personalities into unrecognizable shadows of their former selves. This complex neurological condition, commonly abbreviated as FTD, stands as the second most frequent cause of early-onset dementia, yet remains largely invisible to public awareness despite its profound impact on patients and families. Unlike Alzheimer's disease, which typically begins with memory loss and cognitive confusion, frontotemporal neurocognitive disorder launches its cruel assault on the fundamental aspects of human identity by targeting brain regions responsible for personality, behavior, language abilities, and social cognition. The timing of this disease makes it particularly heartbreaking, as it typically strikes individuals between ages 40 and 65, during what should represent life's most productive and fulfilling years when people are at career peaks, actively raising families, and often serving as caregivers for aging parents. The anatomical foundation of frontotemporal neurocognitive disorder lies in its selective destruction of two critical brain regions that essentially define human consciousness and social existence. The frontal lobe, positioned directly behind the forehead, functions as the brain's executive headquarters, controlling decision-making processes, impulse regulation, social behavior patterns, personality expression, and moral reasoning capabilities. This region distinguishes humans from other species, enabling complex social interactions, abstract thinking abilities, and sophisticated future planning skills. The temporal lobe, located above the ears, processes auditory information, manages language comprehension and production, handles emotional regulation, and contributes to certain memory formation processes. When frontotemporal neurocognitive disorder invades these vital brain territories, it doesn't merely impair cognitive function but fundamentally transforms who a person is at their deepest core, systematically stripping away the essential qualities that make them recognizable and emotionally accessible to their loved ones. The underlying molecular pathology of frontotemporal neurocognitive disorder involves the catastrophic malfunction of essential cellular proteins that normally maintain optimal brain health and neuronal function. In healthy brains, proteins such as tau and TDP-43 perform absolutely critical roles in maintaining cellular structural integrity, facilitating efficient transport systems within neurons, and carefully regulating gene expression patterns. However, in frontotemporal neurocognitive disorder, these normally beneficial proteins undergo abnormal biochemical modifications that cause them to misfold dramatically and aggregate into highly toxic accumulations within brain cells. The tau protein, which normally helps stabilize the internal cytoskeletal framework of nerve cells, becomes abnormally hyperphosphorylated and subsequently forms twisted neurofibrillary tangles that severely disrupt essential cellular transport systems. TDP-43, typically involved in crucial RNA processing and gene regulation functions, inappropriately relocates from its normal position within the cell nucleus to the cytoplasm, where it forms extremely harmful protein clumps that gradually poison neurons from within their own cellular machinery. Frontotemporal neurocognitive disorder manifests through several distinct clinical variants, each characterized by unique symptom profiles that directly reflect the specific brain regions most severely affected by the ongoing disease process. The behavioral variant, which accounts for approximately 60% of all diagnosed FTD cases, fundamentally transforms personality characteristics and social behavior patterns in ways that profoundly shock and devastate family members who have known the patient for decades. Patients frequently exhibit dramatic changes in social conduct, displaying sexually inappropriate behavior in public settings, making crude or deeply offensive comments during social gatherings, or showing complete disregard for social norms and behavioral expectations they previously respected throughout their entire adult lives. Loss of empathy becomes particularly pronounced and emotionally devastating for families, with affected individuals becoming emotionally cold, calculating, and completely indifferent to the feelings, needs, psychological suffering, and daily struggles of their closest loved ones. The language variants of frontotemporal neurocognitive disorder, collectively classified as primary progressive aphasia, systematically attack communication abilities in distinct and progressively devastating ways that gradually isolate patients from meaningful social connections and relationships. Semantic variant primary progressive aphasia methodically erases the fundamental meaning of words and concepts from the patient's mental vocabulary, creating a debilitating condition where previously familiar objects, beloved people, and basic ideas become increasingly foreign and completely incomprehensible. Patients may look directly at everyday household items such as telephones, kitchen appliances, or personal automobiles and remain completely unable to name these objects or understand their basic purposes, despite retaining full physical ability to see, touch, and manipulate these familiar items. The non-fluent variant of primary progressive aphasia primarily affects speech production mechanisms and grammatical construction abilities, making it increasingly difficult for patients to form coherent, meaningful sentences despite maintaining relatively preserved comprehension of what others communicate to them during conversations. The diagnostic journey for frontotemporal neurocognitive disorder represents one of the most challenging and emotionally frustrating aspects of managing this devastating condition, often involving multiple years of persistent uncertainty, repeated misdiagnoses, and mounting family confusion before accurate medical identification finally occurs. The complete absence of definitive biomarkers or simple, accessible laboratory tests means that proper diagnosis relies heavily on careful clinical observation, detailed patient history documentation, and systematic exclusion of numerous other medical conditions that can closely mimic characteristic FTD symptoms. The average duration from initial symptom recognition to accurate diagnosis typically ranges from 3 to 4 years, during which confused families often struggle desperately with unexplained behavioral changes, rapidly deteriorating personal relationships, and inappropriate psychiatric treatments that consistently fail to address the underlying neurological condition effectively. The comprehensive diagnostic process requires extensive clinical evaluation that includes detailed medical and family history documentation, with particular attention carefully focused on specific onset patterns and progression characteristics of behavioral, language, and cognitive changes observed over extended time periods. Experienced neurologists must systematically assess patient symptoms against established international diagnostic criteria, searching for characteristic symptom patterns that reliably distinguish FTD from other forms of dementia, various psychiatric conditions, and normal aging processes. Specialized neuropsychological testing plays an absolutely crucial role in this complex evaluation process, utilizing sophisticated cognitive assessments specifically designed to evaluate executive function capabilities, language processing abilities, social cognition skills, and behavioral regulation mechanisms in ways that can reveal subtle cognitive deficits not readily apparent during casual social interactions or routine medical examinations. The profound impact of frontotemporal neurocognitive disorder on families and primary caregivers creates extensive challenges that reach far beyond the immediate medical symptoms themselves, affecting virtually every aspect of family life, including psychological well-being, social relationships, long-term financial stability, and comprehensive future planning considerations. Spouses consistently describe the absolutely devastating experience of gradually losing their lifelong partner, while that beloved person remains physically present within their shared home, watching helplessly as someone they have deeply loved for decades systematically transforms into a person who seems completely unrecognizable and emotionally unavailable for meaningful connection. Children of affected patients struggle enormously to understand and appropriately cope with the harsh reality that their loving, supportive parent has become cold, socially inappropriate, or deeply embarrassing in public situations, frequently blaming themselves for the dramatic personality changes they witness occurring on a daily basis. Effective caregiving for someone diagnosed with frontotemporal neurocognitive disorder requires the development of highly specialized strategies and sophisticated coping mechanisms that differ significantly from approaches typically utilized for other common forms of dementia, as traditional memory care techniques prove largely ineffective when dealing with profound behavioral and personality changes. The fact that many FTD patients retain their basic physical abilities and mobility creates unique and potentially dangerous challenges, as they may actively resist necessary care efforts, wander away from home without understanding associated risks, or engage in potentially harmful activities while completely lacking the judgment necessary to recognize serious dangers. Current research into frontotemporal neurocognitive disorder has experienced remarkable acceleration in recent years, offering genuine hope for developing effective treatments and eventual cures through multiple promising therapeutic approaches being pursued simultaneously by dedicated research teams worldwide. Scientists are actively investigating comprehensive drug discovery efforts focused on several key biological targets, including abnormal protein aggregations that characterize different disease forms, inflammatory processes contributing to ongoing neurodegeneration, and cellular pathways regulating protein production and clearance within brain cells. International research collaborations are significantly accelerating scientific discovery by facilitating essential resource sharing and specialized expertise across institutions globally, while patient advocacy organizations continue playing increasingly important roles in funding cutting-edge research and providing crucial family support services. While frontotemporal neurocognitive disorder undeniably remains a devastating diagnosis profoundly impacting patients and families, rapid research progress combined with unwavering dedication of scientists, clinicians, and advocates worldwide provides substantial